This is Dr. Bulam Omsawa Makago. Today's lesson is about diabetes mellitus. Diabetes is a metabolic disorder characterized by high levels of glucose in blood, which is due to completely no insulin produced by the pancreas because of destruction of pancreatic cells by autoimmune response or through other causes like surgery. It can also be due to insufficient insulin production by the pancreatic cells or tissue resistance to the action of insulin. Insulin is a hormone that acts as a key that opens up the cells to take up or to allow glucose enter into it so that it is being utilized by cells. Glucose is a form of sugar, the major source of energy for cells to operate. We have two types of diabetes. One is insulin dependent, the second one is non-insulin dependent. We can also call it type 1 and type 2 diabetes. Type 1 is common in children. Almost 80% of all diabetic cases, and type 2 is common in elderly or people who are grown up. The following are some of the signs and symptoms of diabetes mellitus: excessive appetite or hunger, excessive urination, excessive thirsty, easy tiredness, blurred vision or visual disturbances, confusion, generalized itching, and many more. And if you have some of these signs or symptoms, please contact your healthcare provider, a physician, or a doctor to discuss about the details of those signs. Now, let's talk about risk factors briefly. For type 1 diabetes, it is more of genetic and family history. And for type 2, we have excessive weight or obesity, being in a pre-diabetic state, taking a lot of alcohol, smoking, being a black or African race, having the age of above 45, a positive family history, being pregnant, having hypertension, excessive salt intake, and many more. They will be discussed by your physician. For fasting blood sugar, we consider 5.6 to 6.9 as pre-diabetes and 7 millimoles per liter and above to be diabetic. This measurement can be taken twice to be sure on different occasions. Then for random blood sugar, you take the blood sugar measurement anytime. So it is 11.1 millimoles per liter. We consider someone to be diabetic, and it can also be repeated to confirm the diagnosis. Diabetes mellitus is treated according to the type. Type 1, as we said, it is insulin dependent, and type 2 can be managed by oral medication. So if you need any treatment, you'll have to visit your physician for any dosage and drug recommendation. Some of the complications of poorly managed diabetes mellitus include eye problems or diabetic retinopathy, renal problems or kidney problems, which is nephropathy. We have neuropathies, which means the nerve damage, the foot damage, poor wound healing, which can lead to amputation of your limb, skin conditions, which may include bacterial or fungal infections, hearing loss or problems, and many more. So next time we are going to learn the details about type 1 and type 2 diabetes. Thanks for watching. Dr. Bulam Omsawa Makago. Subscribe.